Hey everybody, it is Dr. Mark, and I am here with Dr. Eddie Weller and Dr. Aaron Corley. So we're going to talk a little bit about chiropractic. We're going to talk a lot about chiropractic. So to start it off, and we've all talked before. We've all talked before. Eddie, if I asked you, and based on our previous conversation, how do you define chiropractic? What would your answer be?
Oh gosh. Um, I'm trying to figure out which model I'm allowed to choose. You
Well,
know,
I mean, you speak totally coming from where you're,
sure.
yes, and how, because ultimately how we define chiropractic is the scope of practice in our office.
It
So
totally is. It is. It is.
how would you define?
Well, I tried to do that with a patient of mine earlier today, and as I chit chat with them, I said, "Do you realize whether your condition goes away or it doesn't go away, chiropractic still works?" And they're like, "Well, what do you mean?" I says, "Well, because objectivity is the key here with the science, but there's got to be a way of understanding. Because if chiropractic truly means adjustment done by hand, I'm adjusting the vertebrae to allow your body to express itself. How old are you?" And she's like, "I'm 64. I'm a mechanic. You're bringing me a car that's 64 years old, and every car, regardless of age, works better tuned up. And if it works better tuned up, and if it's neurologically sound, then why isn't the body doing what it's supposed to do? And if it's not doing what it's supposed to do, there's something neurologically wrong. However, there's other variables and factors that can cause the body to break down. But then we went into this whole spiel, because now she's like, hold on a second. It's not going to fix my problem. I don't know. That's not up to me. And I think we were talking one time as we started to have a conversation, brother, between you and I, of chiropractic being physical medicine, right?
Correct.
I
Yes.
remember I got in a little bit of a tiff. I had 3 different debates. One of them was pretty heated with Reggie Gold. And
Mhm.
so we went back and forth. And one of them, I was a trimester 7 student, and he got pretty warm.
Correct.
It was me, Reggie Gold, and Joe Strauss sitting at a coffee table with about 30 delts.
Is this at Sherman, or is this at what
This
college?
was in this is St. Louis when the delts were allowed at Sherman at one time. And
Oh,
so
okay.
it was off campus, and they're all sitting around, and I'm watching Reggie adjust. And I said, "Excuse me, sir, I'm a trimester 8 student, excuse 7, 8." I said, "Excuse me." I said, "I don't know. I know of you. I don't know much because we go to Logan. We don't learn all this stuff. You're here in town, and I'm watching you adjust, and everybody got adjusted in a different way, and that's okay. But how did you know they needed to be adjusted? Because you're palpating through clothes." I don't want to start a fight. I'm just kind of curious." He goes, "Well, we'll talk about that later." I'm like, "Okay." And so we sat down, Joe Strauss, myself, and we're firing back and forth. Joe got up and left. He walked. He left after about 30 seconds. I said, "If it's a philosophy, science, and art, where is the science to show?" He goes, "Well, innate knows." Yes, innate does know, but scientifically, if we believe in that, because BJ was a big guy with the science. However, he was proving chiropractic with physical medicine. And when I didn't understand Reggie at the one time when he was up at the Delt House, and he's up there, he goes, "You have to understand that BJ was a mixer." I'm like, "Wow, let me digest this right now," because I'm eat, sleeping, and drinking the green books, bro, right?
Right.
And I'm like, hold on a second. I got offended by it. I said, "BJ's a mixer." And I was like, I'm not going to say anything. I'm not going to point fingers. I want to hear it out. And when he explained the whole physical medicine thing, how we get sick people well, no, we don't. And I was in that camp for a while, going through the upper cervical space, and you get into that because green books read, we get sick people well. So if you adjust somebody and they die the next day, did chiropractic work? Yeah, I've had that happen several times. The next day they're dead. But did it work? Scientifically, I've done my job. I proved objectively, neurologically, you're compromised, you're not longer compromised. I did my job. So I respect the guy, but BJ definitely, I would love to have a few chit chats with him about, let's go back to a little bit what your father said. Your father's talking about this tone thing. You just tried to prove scientifically chiropractic. I'm with you. Let's go back to that philosophy of tone and let's make sure it's neurologically sound, regardless if a condition gets fixed or not. That's hard for chiropractors to understand because all the chiropractic schools are teaching is PT, right? It's physical, and treat that condition. Be a chiro treater, not a chiropractor. And if it's really done by hand, if I'm able to adjust the spine and step back and watch Ine do her thing, then what more am I going to do for the body, chiropractically, that is? You can do your therapies, massage, creams, anything you want to go do, but do it outside your office. If a chiropractor stayed in their lane, I think we would have a vernacular that would be commonality between one chiropractic office to the next. Across the street from my office is the Joint. I'm looking right at it, and there's no exams. The philosophy, they talk about the power that made the body heals the body. No, it doesn't. No, it doesn't. The power that made the body can heal the body. It doesn't heal the body, only given an opportune time. So again, if you adjust somebody and they don't get well, then what happens?
So
Did
how
it
so
work?
how should we define it? So then, like, when you say that, and I'm with you. Now, there's certain things that I could point out. Like one thing is, does it have to be done by hand only?
Does it have? No, no. I'm just saying by definition of what we've been taught, but instrumentation works absolutely.
Sure.
To me, it's about an adjustic thrust.
Okay. All right.
If I find a vertebrae and I justify a subluxation of a vertebrae, and I intentionally apply an adjustic thrust by hand or an instrument, and I apply adjustic thrust, and that vertebrae with the intent is to restore neurologic function, to me, you're practicing chiropractic.
Okay. Cool. So to keep on going down this road, because my conviction is chiropractic philosophy needs to be written in pencil. Yes, the principles are sound and eternal, because they're basic science.
Yeah.
It's our ability to understand them that
Mhm.
changes. One of the things Claude Lessard has done that I really admire, he's taken the 33 principles, and rather than looking at them as purely philosophical terms, he's looking at them as chiropractic's basic science.
Yeah.
And it's not, of course, it's not pertaining to chiropractic. And one of the things that Dr. Koch did, David Koch did in his book, that I thought was very interesting is he categorized the 33 principles into three groups, which I found to be very accurate.
Mm.
He categorized them into universal principles, biological principles, and chiropractic principles. And of
Yeah.
the 33, only three are exclusive to chiropractic because, we're going to talk about universal principles such as there's a universal intelligence and all matter continually giving its property and actions, thus maintaining it in existence. That's
Sure.
that's something every basic science,
Right.
whether you're studying the
Yeah.
law of thermodynamics or
Yeah.
centrifugal force or centrifugal force, can all agree with. One of the things, do you know who Robert Leach is, Dr. Leach?
Uh-huh.
I talk with him on a monthly basis. And one of the things that, and I'm reading his book from cover to cover right now, Chiropractic Theories.
I was
And
about to
I
say,
love,
in the theory book, yeah.
yeah, that's exactly right. I
Yeah.
love him dearly. We both love chiropractic. We approach it from two totally different schools of thought. One of the things that he was saying, like, look, philosophy is theosophy because everything was personified.
Yeah.
And BJ, granted, we have the privilege of standing on BJ's shoulders. I love the green books. I've read every one from volume 14 on, most of them more than once. He does personify universal and innate intelligence, and then that makes it into a deity.
Right.
Now
Right.
we're in theosophy. So if we're
Yeah.
looking at it through the basic,
BJ said if I can turn it to a religion, I would.
yeah, and that's unfortunate because now
Yeah.
now we're bound by a whole thing. Now we're outside of science and we're into faith and belief. And I'll
But
let you.
he also only said that because there's more faith in a religion than there is that there's an inherent ability for the body to maintain itself in existence. Right. And so it's
Yeah, I think that, but I still would disagree because that once again we can see an observation that the body is striving to not only exist but adapt and constantly get stronger.
right.
And so if we look at chiropractic, like
To me,
really,
that real quick, to me, that's the ultimate point, the only point. Is I eat, sleep, and drink the three T's in this office. I talk a ton about them here. And I explain that to people. I says, my goal is to get your body strong enough neurologically so it can adapt to the stress that you give it outside my doors. Right. And so,
and
right.
okay. So I'm following you on that. I'm trying to follow you on that. Like, I guess you're talking about thought trauma toxin. Is that
Mhm.
what if there's something? What if there's another stress that could?
There is another stress would be electrical. Well, that's
I
a
mean,
biggie right now.
what if there's things we like with Steve and Stevenson? I think Stevenson really tried to get away from the personification of the different intel. I think he was trying in a
Mm,
lot of ways because, of course, Stevenson says that he put together all these lectures of BJ. I've listened to the vast majority of
right.
BJ's lectures. He didn't go into the elaborate. He didn't go into a lot of the things that Stevenson did. So when Stevenson talks about the vertebral subluxation, the vertebral, and this is something that I'm actually writing on currently, the vertebral subluxation is specifically a limitation of matter. And the cause of the vertebral subluxation, as Stevenson put it, which I think is incredibly accurate, is one, defining the vertebral subluxation as a limitation of matter that can occur when the external invasionary forces overcome the internal resistant
Right.
force.
Constructive, destructive, right?
Yes.
Yeah,
External invasive being,
overcoming the internal, yeah,
yes, because
yeah,
if like the external invasionary forces are converted to an innate force, which is what ultimately leads to, say, an adjustment as well as many
just,
other
yeah,
things,
yeah,
yes, then that's constructive. Um, and Claude Lessard rewrote a lot of the 33 principles in a way that's a bit more accurate based on what we know now.
sure.
So the thought trauma toxin, I think, is very limited because
It
in
is, it
reality,
is,
it could be so many more things. So if we
yeah,
say
yeah,
that the causes of vertebral subluxation, one is a limitation of matter. And I would say this, DJ and even Stevenson wrote from the idea that innate intelligence resides in the brain, and it doesn't. And
right,
they,
right.
yes, and they said that you cannot have interference to the afferent pathway.
Now, it's funny you say that real quick. That's so crazy you say that, because I had a debate with a few guys and I said, it's not brain cell to tissue cell.
No, it's definitely not. It's definitely
No.
not.
And they're like, they thought I was crazy, the safety pin cycle and the whole thing. I'm like, it's off. And it's
Totally,
point, I mean,
100%. Anatomically, David Koch goes into this in his book. Claude really makes a great point, and I really love this. That in chiropractic, we're not concerned with the cell because the cell receives the information
impulse.
from innate
Yeah,
intelligence. No, they receive it through innate waves. They receive it through innate waves. Whether or not that can be interfered with is not a chiropractic issue.
right,
Chiropractors deal with the tissue. So the
yeah,
tissue that's being supplied by nerves is what chiropractors deal with. Tissue is ultimately making up organs, and organs making up systems, and
sure.
so
Yeah,
forth.
yeah,
So when we're looking at the actual chiropractic objective, for every structure that was intelligently designed within the body, there is a function. Now, when we look at the nerve system, let's say specifically the brain, spinal cord, and nerve roots,
right,
when we have a vertebral subluxation, and I prefer Stevenson's definition of a condition of a vertebra that's lost its proper juxtaposition with the one above, the one below, both to an extent less than a luxation, which occludes a foramen, pinches nerves, and interferes with the transmission of mental impulse. What I would modify is to say innate impulse, because
yeah,
innate intelligence is not only creating the mental impulse, it's also creating the impressions that are happening in the periphery. The fact that it has to have continuity is a
right.
limitation of matter, not a
It
limitation.
has to know what it needs to supply,
Yes,
right?
and that's for the
Yeah,
continuity of the matter. Innate
yeah,
intelligence
yeah,
already needs, therefore, innate intelligence never enters or destroys the structure in which it
right,
works.
right, right,
It matter's ability to carry out that function. And one of the things Reggie Cole did talk about, which I thought was genius, SOT talks about this too, and I'm sure in upper cervical as well. One of the biggest things that we work with, and I know very much in upper cervical too, is that you have the meninges that form dentate ligaments, and research is coming. They're finding more dentate ligaments on many different various levels of the spine. And
right.
Reggie would talk about when a subluxation does occur, and you have this three-dimensional, you know,
Torque,
torque of the meninges. You're creating a smaller
right?
opening now. And
It's like Indian wringing out a rag.
that's exactly what's happening. And it's causing an increase because now you've made the hole smaller, which increases the pressure on a confined fluid. And as
Yeah,
Pascal law tells us, when pressure is increased on a confined fluid, that pressure is exerted everywhere that fluid is present, which is
yeah,
all over the brain and spinal cord. Now you
yes,
change the shape of the brain and spinal cord, and it doesn't matter how small,
right,
it doesn't matter within how many half of millimeters, it's changed. And when you change the structure, you change the function, it can no longer receive
yeah,
impressions and mental impulse as it was created. So looking at the vertebral subluxation now as affecting the whole body because it's altering the structure
sure.
of the brain and spinal cord. Um,
So what about what would you, I mean, where's the origination of where innate's emanating from?
and that's a great question. Innate intelligence resides within the whole body. It is a
It
totally
does, but I can cut your arm off and you can be alive.
100%, yes. My arm would no longer be functioning under the innate intelligence of my body, and
Yeah,
innate still residing in the matter that's left.
Right,
What happens now is my arm would go to that cellular intelligence, which eventually would be totally taken over by universal intelligence.
right,
Remember, it needs simply an extension of universal that's limited to the matter in which it resides. And
yeah,
it's concerned with the survival of the whole structure of matter. If I were to remove my arm,
right,
this is another thing in the 33 principles I disagree with, that you don't always have 100% matter. And vertebral subluxations limit that 100% matter, but you will always have 100% innate and a
yeah,
100% force that it creates
yes, yes.
information.
Per the matter which it resides in. And this is one of the
Correct.
conditions that I was intrigued about. We know of hydrocephaly, but then hydranencephaly. I wrote it in 2 books. I'm fascinated by this. It's called hydranencephaly. Hydranencephaly is literally being born without the hemispheres of the brain yet being alive. It's the craziest thing. And so if, again, when the people talk about the brain keeps you alive, it doesn't. You can be born without the brain, and this matter is alive. Yet when the sperm and the egg unite, the neural streaks formed and the brain stems formed, and from the brain stem it grows a balloon, your brain, it grows a tail, your spinal cord. There's the only reason why I do the upper cervical work, is because the disjunction between the most vital area in the body, where the first thing in the body that was formed allows it to express above and below. That safety pin, it's just a junction highway. And so again, I can cut your spinal cord in half. You have spinal cord injuries all the time. They're alive,
Yes, yes. And
right?
and this is, yeah, and that's always been fascinating, which does negate the whole safety pin cycle of one cell, because, and even in David Koch's book, there was times he's like, look, that brain cell allows the emanation of that floron of
Yeah,
metallymphos, and it goes, but the anatomy doesn't support that, because you have plexuses and the nerve fibers are constantly changing and overlapping. It's
right.
totally amazing how the body's created. But going back to the other, when we talked about the definition that I've enjoyed for quite a few years, and Reggie was involved with this definition, as was Jim Haley, Joe Strauss, Joe D'Onofrio, Mark Osteen, myself. We were all together working on this definition when we were in the
Okay.
FSCO. Is that chiropractic is the analysis and the facilitation of the correction of vertebral subluxations, because they, in and of themselves, are detrimental to the expression of innate intelligence. Chiropractic is all education toward this objective, and chiropractic is nothing else.
Yes.
So, and understanding that
Regardless of how you apply a force to the spine or whatever that is,
100%,
if your
100%.
analysis is as such. But again, if it is as such, what is, and this is more where I'm going in 2025, where I want to create this revival of the principles of what we have, but there's got to be a way between how you analyze your patients and how I analyze mine, where there's a chiropractic exam. What is that? Because we believe in subluxation and vertebral only, but if it's a vertebrae that's subluxated, I don't care where you want to argue that in the spine. How do you know it is, and how do you know it is not? And I
Well,
think that variable is huge.
it's a massive variable. There's no question about that. I don't know if we're ever
And we'll
going to
never
come.
grow. We'll never
Yeah,
grow.
I don't know if we're going to come to, because Mercer tried to do this. Even in Dr. Leach's book, there's been 2 different attempts to try to come up with a commonality of chiropractic procedure for every person you see. Like in my office, I don't refer to my the people I see as patients,
Right.
because that to me
I
is
call them, my first book I wrote, I call them clients, and people came out of the woodwork. They're patients. I'm like, no, you're a client. I'm providing a professional service.
yeah.
Right?
I call them members. I call them members of my office.
But are
I,
they? But are they? I mean, do they sign
yes,
up for a membership? Do they pay a monthly
yes,
membership?
yes,
Okay, good. So do mine. That's
yeah,
and it's a lot of people call them practice members, folks, patients, whatever. I
yeah.
remember going to a chiropractic seminar. I said, hold on a second. If I go to your office, brother, and you analyze my spine and adjust me, am I your patient? They're like, well, no. What's the difference then? If I'm not a patient, then why are your patients patients? Right? They shouldn't
Yeah.
be. You know what I mean?
Yeah,
No.
yeah. So, but to me, I don't. It's not a big enough argument to really, okay, we need to focus, and that's me, and that's me.
Right.
Now, I
But
can
my
tell you,
argument is that the neurologic one is a huge, if all 3 of us were cardiologists, what does the cardiologist do? They do cardiology exams. And we
They're
don't
still gonna have
argue
a
that.
difference of opinion. They're still gonna vary in their opinions and how they go
Sure,
about it.
but you're not gonna argue the objective data. They're gonna say, what was their blood pressure when they came in? What was the respiratory rate? What was the, I wanna know that. We don't do that, Carl. If we're talking eat, sleep, and drink the spine. My ex-wife, when we were talking, when I met her, she's a lawyer. She's a PI lawyer. She's like, I crush you guys in court. I've never lost to a chiropractor in 18 years. I kill you in court because you have no data, until she met me. And I said, let me
And
show you the objective data that I find, the range of motion that's, digital. I do infrared thermography. If the nerve is compromised, nerves have electricity. You compromise electricity, a byproduct's heat. Every time. And so if
now,
there's a way to gauge the nervous system based on heat, let alone, at least there's something objective. You know what I mean?
it's somewhat objective. Keep in mind, and Dr. Leach would say this in his book, the research for instrumentation
So, hold
has
on,
not been
I'm sorry, real
consistent.
quick. Is the dog outside? It's pouring. Sorry, go ahead.
Yes, the research in regards to saying, okay, this is absolutely objective, especially with instrumentation,
Yeah,
is not there yet.
sure.
And
Well, what even Rob Sinnott would say, what about HRV? That's a great way to do an analysis, right? You do before and after, you see an HRV, you make an adjustment, HRV changes.
now HR, you're talking like heart, is that
Heart rate variability, yeah.
heart, but once again, conclusiveness. I mean, yes, we can see all these different changes. And one of my frustrating things about research is, why do we have to research all these different things? Can we not, like, for example, I could tell you from my technique, and for me, I can criticize every technique out there, including my own.
Sure,
I could say, okay, instrumentation, you have across the board different theories of what's being measured. Are we measuring a capillary bed?
right.
Are we measuring skin surface temperature? Is it better to use an infrared? Is it better to use thermocouples? Is it better to use a thermal scribe? So, and there's
I
massive.
wrote, yeah, right, and I wrote all that in my book, right, of infrared thermography and the history and of all that. However, regardless of whatever it's reading, it's still reading something.
It's reading something. Yes,
Right.
it's reading something. And
It's kind of like a fever. If I have a fever and I take my temperature, what's causing the fever? It could be a million things. I'm still getting a temperature reading. It's the same thing with the spine. If we had a gauge, I mean, what's a chiropractic gauge? BJ tried in 1924. Say, I got an NCM. He tried something that would find some scientific continuity. We don't have it. And that's the biggest variable because we get laughed at by the rest of the world because, oh, chiropractors got morons putting, microphones on people's spines, using their chiropractic table as a stage. And
that,
so
yeah, that's I don't understand, and I think there's a loss of
they should
sacredness.
lose their license. They should lose their license.
Well, I hate. Look,
No,
man, we just, yeah,
no.
I think
I'll be the Trump. You're fired. Get out of here. I
before
have
we
no
go to
problem with
that
that.
level, before we go to DEFCON 4, I think, look,
Because it's
let's
not a
talk.
toy. It's not a toy. You know what I
No, I'm
mean?
with you. I promise you, I'm with you. To me,
Yeah.
this is so sacred. Cameras are not allowed in my office. People say, "Oh, can I film?" Like, no, you cannot. This is sacred. This is a sacred moment, and there is no filming. And I don't
Yeah.
even think the chiropractors who do this because our terminology is sacred. Dr.
Yeah,
Crack,
yeah.
Dr. Pop. I mean, our lexicon is sacred. You want to
Sure.
change people, change their language. But when we look at things, we have to understand everything we're talking about right now is theory, and even how the brain works is theory. So we have to any profession that works with the human body works the majority off of theory because we understand very little about how this body actually functions. We understand very little about how this brain thing actually functions. We don't understand what our thoughts, you see. So we have to all be humble to say, okay, and Reggie would say this: the body is more of an art than a science, regardless of what
Yeah.
it's not saying we don't have it. Like, for example, I use advanced muscle palpation. Now, what is the theory behind that? And this is something we can argue over because this is fun.
Oh, we could.
Yes, I'm not concerned with fixations. I'm not concerned with compensations. I think that's nonsense. And I think BJ was absolutely wrong when he said a primary and secondary vertebral subluxation. I understand where he was going, and we disagree because black and white, either it is subluxated and your body's trying to adjust it back where it belongs. Even the definition that I gave you, I don't
Yeah.
like the word correction. It should say adjustment because that's
Right.
our term. Either it's a vertebral subluxation or it's not. And if it's a vertebral subluxation, we
Yeah.
do not know what innate normal is. Oh, and I'm gonna throw some gas in the fire. X-rays do not tell us what innate normal is. They do not give us any viable chiropractic information.
True story. True story.
So with that being said, and
It's just a moment in time. Yeah.
yes, but even then, all it tells us is what's not geometrically straight. No spine is geometrically straight
Right.
because we're all one-sided dominant. We grow right and left independent.
Yep.
What we're looking for, nobody knows what innate normal is except the body. The best a chiropractor can do is educatedly place a universal force through its education in the direction that we educatedly think the body's trying to make the adjustment. Our intent is for that universal force to be
To accept that adjusting thrust, yes.
to change it to an innate force. And
Right.
when that happens, now it's a constructive force that the body can now make the adjustment.
Now, how do you prove that you've done that? Because
That's a great
the
point.
tonicity of the muscle?
Now, this is what we call them working muscles. This is an excellent question. The system that's involved with motion with the body is the muscles. So when a vertebral subluxation is subluxated, the paraspinal muscles are working very hard to try to pull that bone back in place. The innate intelligence has lost some control over that vertebrae.
Assuming that's not a compensatory area where it's doing that.
I don't even think compensatory, because to me, I've never heard anybody explain it to say that's a compensatory. No, either it's totally black and white. Either it's a vertebral subluxation that the body's trying to make the adjustment. The body's not going to try to adjust something that's compensating. The body's not going to try to adjust something that's good.
Yeah, yeah.
When the muscles are trying to pull the bone back in place, that gives us the presence of a vertebral subluxation and the vector in which the body's trying to make the adjustment. Now, some of the science supporting this, not the only science, but some of it, and Dr. Ron Castellucci had a great research project.
Yeah.
Proprioceptive fibers are the most dense in the zygapophyseal joints of the spine than anywhere else in the body. And there's a direct reflex arc between the zygapophyses going up to the thalamus, hypothalamus, and directly back down to the paraspinal musculature that supports. It's not all conclusive, but it supports this theory of thinking. You see what I'm saying? And then I'm just now
So you can have 5 subluxations?
It's possible.
Okay.
It's possible.
Okay.
You see, analyzing from the sacrum. Now, keep in mind,
The problem is I mean, I hear exactly where you're at, and my argument is not even to you, just to anybody who's doing some sort of patient. This was my argument with Reggie in trimester 7 in 1997. Is just like you introduced the force to the spine, you shifted that vertebrae according to what you educatedly thought, where you applied adjusting thrust, and innate took that force and puts the bone where it needs to go. He's like, yeah. How do I said, perfect. How do you know it's there?
Well, you do your post analysis.
He didn't do it. This is adjusting through close, putting a force here in cavitation and walking away. Right? And so there was no post-analysis anything. There wasn't even analysis in the beginning, because chiropractors go to seminars and they adjust each other where there's no exam at all.
I guess my argument, and I've seen Reggie, as far as, analyzing through the close, I don't have a problem with that. I respect where you're coming from, and I know Joe D on the first visit would down everybody.
Well, just because school teaches skin on skin, and now you graduate school and you don't have to do that.
Yeah, I never went skin on skin, and I was heavy upper cervical guy. I'm actually KO certified, believe it or not. And I love the upper cervical. I'm just absolutely convicted that there's a subluxation below C2, and quite frankly, I've never seen an upper cervical guy, girl, gal, whatever, that was outside the realm of physical medicine. So if
right, because of that guy.
100%. My quest is objective truth. I'm not here to be right. I'm here to be questioned so we can all find truth.
Yeah. I mean, I question a bunch of stuff that happened, but we should. I mean, that's how we grow. I mean,
that's how we grow. I want a powerful argument, because if I'm wrong, I want to know. And if I can't argue my case, I got to go back to the drawing board and come up with a better argument. We all grow.
The argument to me always is if I put you on the stand and we're talking our philosophy to them and they get it, it resonates with people. However, they're going to go, if you believe that there's a neurologic compromise due to the subluxation, right? We believe that. It's compromising nerve function or transmission of normal flow. If that's the case, sir, I'm playing devil's advocate, but if that's the case, how in the world do you know that one, you found it, maybe the tissue was taut, and now the tissue is not taut, but you just said it's about nerve function. So what are you doing to make sure that the nerves work in the right way?
Okay, and do you want my answer to that?
Yeah,
Okay, well, counselor, when we look at the human body, there are no empty spaces. So when a vertebral subluxation is in existence, and I am trained specifically and exclusively in the detection and the adjustment of vertebral subluxations. So your body has indicated that the muscles around this isolated segment are trying to pull the bone back in place. If this bone is subluxated, there are four components that are happening. It's misaligned compared to the one above, below, or both. There is an occlusion of the opening, whether that's through the spinal canal or through the intervertebral foramen, which is going to lead to nerve impingement, interference, or compromised nerve tissue in some way because there are no empty spaces in the body.
right.
And then third, that's going to interfere with innate impulses coming in and going out. So these are
Yeah.
things that we can observe anatomically, and it's also based on logic and our
It is, but two of the
philosophical
four,
approach.
you can't, to the layperson, two of the four, you cannot prove.
Now, let me tell you something. As far as proof, you can't prove any one of the four. There's none of the four you can prove. There's none of the four. This is a highly metaphysical
It
concept.
is. So the
And
argument is the super straights, and this is where I get argued with all the time, talking super straight with other chiros, is that you can be so straight you're crooked because of the fact that there's no way scientifically to prove your work. It's all theory.
But here's the thing, there is nothing science when it comes to the body to that extent. This is why I don't care what profession you're in, everything
Right.
changes on a constant level. Eggs
Yeah.
are bad, eggs are good, eggs are bad, eggs are good with every different decade. So, and now it's like, oh, well, we thought that there was more neuroplasticity or less neuroplasticity in the brain. And now we're finding this. And now we're almost understanding what a thought actually is. Is it chemical? Is it electrical? So the reality is, what you
Right.
just said is true for every profession. The question comes down to, can you make a logical case that's anatomically sound based on the information that we have? This is across the board. 100 years from now, Eddie, you and I both know people could be in shock that there was a profession that used something like anesthesia for surgery, but it's the best they have right now. Anesthesia
Sure.
is not good for you. There is
Yeah.
a range that they hope is going to take most people in and out of a induced sleep and not kill them. That wasn't the case for Kanye West mom or
Right.
Michael Jackson, but there is that understanding. Right now, it's the best they can do. I've had about 7 surgeries in the past 15 years, so I'm thankful for anesthesia. But I guarantee you there's going to be a better way because our understanding of the body and the physiology will improve. Chiropractic is no different. But here's what amazes me. As we've discovered more anatomically, as we stood on the shoulders of Dee EJ, Reggie Gold, Sid Williams, Joe DiNapoli, Joe Strauss, we are still doing so many things in a similar way with a more specific approach, perhaps, and a better understanding of it. So a lot of the research coming out isn't like this, oh, this is unbelievable. I can't believe this. No, it's like it's 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 reaffirming what we've been saying for 129 years. That's kind of really exciting.
It is. It is. But there was a patient of mine. He's a medical doctor. And he's just rocking on my world, showing me you guys are going to cause stroke, vertebral artery, a lot of stuff. Women's Health this past month just rocked on chiropractors, how we're tearing vertebral arteries and that kind of stuff, just yanking. And I said, hold on. I said, outside of how the adjustment's made, I said, outside of all of that, I said, I put him in a gown and I scanned the entire spine, infrared thermography. I said, see that crooked line? I said, so I don't know what's going on. There's just generating an abnormal heat imbalance. I said, but if I make an adjustment to the spine and that crooked line goes straight, physiologically, something changed because there's no longer possessing heat at these different levels. I don't know what that means exactly. I kind of do, but I don't know what that means. But I know I've done something constructive, that there's been some sort of stuckness, if you will, that the body's stuck in this static state, and now we can get it out of that. So now you're in a state of flux. I said, let me show you a scan. So I brought up a patient that's been with me for 18 years. And I said, this is their day one 18 years ago. And here's today. They came in today. And I overlaid that. That matches 18 years apart from one another. That's science. It's reproducibility that when you subluxate, you're going to go back to the same abnormal neurologic compromise because of that abnormal bony mold, regardless of where you believe subluxation's at. And so again, there's proof. How does the scans match 18 years apart?
No, there's no doubt there's something there. There's no doubt. And I'm going to tell you another thing that you might find very interesting. You know who Nick Spano is?
Oh yeah. I watch, he follows me all the time. We go back and forth. Yeah.
Yeah, I love Nick, and I wish he had this. I wish he had this. He did a research project. I was at Sherman. I was not part of the research project, but he did it. This is probably dating back maybe 15, 20 years ago. I don't know.
Yeah.
They did a controlled study comparing the analysis of advanced muscle palpation, which Nick Spano, he taught me. He was one,
Yeah.
he taught me. Nick Spano taught me. Joe Joe J. D'Onofrio Jr. taught me. Ron Castellucci taught me. And they did instrumentation as well. I
Yeah.
don't know which kind of instrumentation. I don't know if it was an infrared
A
myography type.
thermocouple. Yeah.
A thermocouple, correct. There was, if I'm not mistaken, a 90 percentile correlation with the AMP and the instrumentation. I thought was amazing.
Yeah.
I asked Nick about it. He didn't have any of the information. Of course,
Sure,
Nick
sure.
knows a lot of things.
Sure.
But when I'm talking with Dr. Leach, who is an amazing chiropractic researcher, and I get that the research, because they wanted to be, published in the medical journals, takes a medical approach. Yes, there's things that we can convert over that help what we're talking about right now. There's no question there. But when I do talk with him, and he's like, sadly, we need more research on instrumentation. When we're talking about double blind, single blind studies, different types of control groups and such. He also talks, the BJ Palmer research. Both of us know, okay, BJ Palmer had his research clinic from 1935 to 1951. Yes, 3,300 hours of man hour, and then we happen to find all of this research in an elevator shaft somewhere. He's like,
I've been in that room. It's crazy. I've seen the file.
Yeah, I went to Palmer, yes. And it's like, okay, none of this was published research.
Right.
None of this was double-blind studies. He's like, none of this makes any of the research journals. And it's not to his credit. Even, BJ's electroencephaloneuromentemograph. I don't think and unfortunately, he was the only one that could read it.
But we had EEG today. I mean, why don't chiropractors use that? I was arguing that the other day. If we believe it's the mental impulse is being compromised, innate force, why wouldn't we gauge that? And do that. We should. I mean, we should.
I mean, I'd have to look at it, because my question would be, are we really measuring an innate impulse? I mean, what are we really looking at here?
All I want to do is if you can I don't care what you do, but if you can objectively gauge physiology, if you just did your analysis, and there's a urinalysis change, do that, or do blood work, or blood pressure, or HRV, or scanning. I don't care what it is. Have it objective, not subjective, because the way you palpate is going to be very different than me. And so therefore, we can't share patients in the same way, because we're going to identify different things. There's no reproducibility from one chiro to the next. And that's the variable.
That is the variable. And I know BJ wanted to eliminate that, but my argument is that variable is always going to be there.
Yeah.
And I'm okay, because I don't care who you're with. I don't care what medical personnel. There are medical personnel that I see. I give blood. I love to give blood. And you think, okay, they're going to take this needle and they're going to put it into my vein. It is never the same with any person who does it. The objective is the same.
Sure.
And I get pretty good veins, And some people, it's so smooth, like, oh, that was nice, because it's a big gauge needle when you give them blood.
Right.
And then there's other people,
I mean, I'm with my phlebotomist she just left here. She's under care with me. But that is a totally different thing. They're not measuring physiology. They're just applying something, right? We're talking physiologic change.
Okay, and I guess, and even then, it's like, okay.
Well, somebody handed me an 8-month-old last week. Hand me their 8-month-old. They're doing like this and say, here, can you check my child? Yes. I check the child and I explain to them, I use all these different objective analysis. I'm doing temperature readings at the faucet. I'm teaching them all these different things. I said, I want to see a temperature change because it's stuck. I said, if it's stuck, then where's physiology? The body can't adapt to the stress that this baby's gonna really be involved with the rest of his life. I said, so let's do this. So I did the whole analysis. I show him a shorter leg. I do all this different kind of stuff. I said, this is stuff outside of me telling the body what to do. I'm just measuring things. And then I do an after measurement. And so that before and after, again, it's not an Eddie Weller show. It's an objective show. I'm trying to find more objective. That's why, like HRV is awesome, or blood pressure. I used to do blood pressure all the time. It's put people on 2 scales, have them stand on 2 scales. Oh, you're 18 pounds heavier here. You get adjusted, now stand on it. Now you're only 4. I made a change. That's an objective gauge. You see what I'm saying? And I think someone, something, some organization, and I was hoping it would be definitely in the straight one, that's where we resonate with, is that there's got to be some sort of continuity. We have to all come in agreement, something that says, hey, chiropractic schools, this is a chiropractic exam. Anything else you want to do with that, you can add to it, but this is the baseline reading. That's the only way, brother, we're going to make a dent in humanity. That's the only way.
I would argue that. Because here, what I would say is, okay, we don't have, like, to me, we want to make, like, my mission, 7.8 billion people seeing their chiropractor every week. I don't want to do everything, all those measurements, but yet we don't know what innate normal is.
Right.
Let's do exactly what we know. If our goal is the same, to find vertebral subluxations and facilitate the adjustment, now we can reach 7.8 people because we can have, okay, this is our goal. But you know what? Because chiropractors who don't even want to acknowledge a vertebral subluxation, I don't know what they do. It's whatever we reach their own. So my mission is to have 7.8 billion people seeing their chiropractor every single week for one thing, thinking in the box for one thing, to have my spine checked for vertebral subluxation. If I go and I see you, I would say, hey, Dr. Eddie, could you please check my spine? I'm not going to ask you anything. I'm just going to enjoy you doing what you do. Even chiropractors, whether it was upper cervical, I've had upper cervical with Michael Kim.
But not even upper cervical, but there's 114 chiropractors within a 10-mile radius of my office. Okay. So it's 114. Let's say you do an analysis on me, you perform an adjustment on me. Awesome. Whatever that is, whatever you do, you said, I adjusted you. Great. I'm not questioning that. Now I go down the block to the chiro. I walk on in and says, hey, can you check me? Sure. They're going to find something. And then the next one, they're going to find something. Who's right? Well, not everybody, not all techniques work. I'll argue that forever.
I have no problem with that. There has to be certain elements of
continuity.
Empirical reason. Yes. Yeah. Because you can't just say, well, I think this, and then I'm going to do this. And I get what you're saying.
Right.
There is an art form to this. But here's the thing. If a person comes to see me, I'm going to do the best I can with where they're at. If they don't tell me they've seen another chiropractor, that is now a variable that I am not informed of.
I don't allow my patients to. I said, you go finish that, whatever you have to do. You can't do both. You're going to confuse the system.
It is, because I'm going to tell you another thing. If you saw 2 different cardiologists, same thing's going to happen. They have different opinions and different ways of going about doing things.
Yes, I agree. I totally agree.
Yes, a different orthopedics that I've seen.
Yet, hold on, but yet the cardiologist will go, hold on, you see another cardiologist? Let's see what your blood pressure is. Wow, it's actually a good number. Whatever they're prescribing is working. That they had a gauge, right?
Yes. If it is at a good number, but what if it's not? Or what if that particular drug?
Well, that's another argument. But at least that's another argument. But again, objectivity. I mean, I was at school at Logan. We were in one of the largest classes, 189 students at the time, right? In 1995, everybody's laying out talking, and this instructor walks on in. He and I butt heads bad. And he's like, I've been told I'm one of the better adjustments here on campus who'd like to be adjusted. And he's adjusting all these, no exams, because chiropractors believe that a cavitation is an adjustment. You didn't cavitate to subluxate. What makes you have to cavitate to not subluxate?
I totally agree. I get it. I get it.
Right.
It is frustrating.
And it's so frustrating to me. I mean, I can't tell you how many times I've walked from this profession. I'm like, I'm ready to leave. I think I'm going to leave this thing. And I can't. As much as I've tried, I can't. And a guy who I adjust on, the table I adjust on is a friend of mine I went to school with. He did chiropractic for about 6 years, got out and did real estate. He's like, you got to be out of your mind. Our profession doesn't understand vertebral subluxation, and you want to start teaching patients about it? You're nuts. I'm leaving. That was 20
Well,
years, you know?
you got to have a passion for it, because you are
Yeah.
going to see the same thing over and over again. Not everyone's going to be with you, and there are chiropractors who, believe it or not, some of them don't care for me at all, and
Oh,
I
I'm
and
with
I'm
you.
and I'm okay with that. I want everybody to have freedom. I want everybody to be
Right,
exposed to
right.
what they do.
Right.
And I really, because the reality is we're in a massive shortage of chiropractors. If every chiropractor in the world
That's
knew,
because chiropractic schools are not producing chiropractors, though.
but yeah, that's a whole nother argument.
Yeah.
Chiropractors themselves, no matter where they're at, most lack vision. And the vision of, hey, everybody has vertebral subluxations. Everybody needs to be checked by a chiropractor. And
Yeah.
chiropractic is not about physical medicine or the treatment of symptoms. It's simply about helping people live better through the adjustment of vertebral subluxation.
Better expression, better expression. That's really what it, right.
Yeah,
Right.
better expression of innate intelligence. So if
But as
100,
as I said last week, if you don't believe in subluxation, you need to leave the profession.
well,
What else do we have?
that's from my opinion, thinking in the box, that's our unique selling. But that's the only thing that's the exclusive thing I do in my office is I analyze and facilitate the adjustment of vertebral subluxations on everybody. You asked me what's your exam? Analyzing the spine and
Right.
safely making a universal educatively placed force so the body can make an adjustment so
Right.
vertebral subluxation can go back to innate normal. If people want to practice any other way, we have 50 different state laws, be within the law, that's on them. If we had 100,000 people in our, every chiropractor is 103,000 worldwide. If they all came to the United States and they opened up, every chiropractor would be seeing over 3,000 visits a week. And that's if people only came in one time.
Yeah.
I mean,
We couldn't do it. We couldn't do it.
yes. And if chiropractors don't start thinking, BJ said it, he was quoting the Bible, where there is no vision, the people perish. And I think that, okay, just like you're saying, we have different schools. Now we have with different schools of thought. And Eddie, I'm going to tell you, if you would ask me what's the school that supports our thinking more than any other school in the world, Sherman College.
It is Sherman.
Yes.
Yeah.
Yes.
It is.
And the Chiropractic Trust is exclusively focused on the non-therapeutic model of chiropractic.
Yeah.
I love to have you in it, bro. And here's the thing: I know you're passionate, man, and we're going to continue this conversation because you don't come with just passion. You come with a lot of great knowledge, and I love where your heart is. I could see you doing research. I could see you because all these things. I want to get you and Dr. Leach introduced. I'm sure you talked with Matt McCoy as well, right? Good, because I see you got
He's
the
a
mind
genius.
for research.
That guy's a genius.
I love it, man. I love it. Haven't talked to him in a while, but I'm glad you guys are talking, So that's awesome because I see you have a mind for this, and I get where you're going from. Even when you're saying, look, because even Dr. Leach is the same way. The more information we get, the better. If you have anything out there, bring it to me, and we'll see if we can put it together into it. So if you ever want to get your information to Dr. Leach as well, let me know, and I'll make that connection because
I mean, it's if I had one choice or one choice at all to change this profession, I would do this. I would treat it like a law, like lawyers. If you told me, say, hey, what do you do for a living? I'm a lawyer. Your next question, because the world's been educated, what kind of a law do you practice? What kind of law do you practice? Right. So you're a chiropractor? Oh, can you just rub it? No. Why don't you ask me what kind of chiropractor I am? The problem is that the world hasn't been educated that there's hundreds of different types. And so
I would say there's two types. There's types that are in the therapeutic model, and then there are those who are in the non.
That's the IFCO in you, but I'd say
that's the chiropractic.
FICO in you, yeah. But it is, but it's
chiropractic trust, yeah.
There is, but again, you different kinds. So there's sports medicine chiropractors, there's infant, chiropractors, there's geriatric. At least what people understand. And so when people come here and they get referred on in here, what do you know about me? That's the first thing I ask patients. What do you know about me?
Sure.
And they said, oh, you don't pop people's necks. That's all you know about me? Well, no, you arrest people. What else do you know about me? And they go through the whole protocol because they've been, this is what we do. And so again, do I fix things? Do I secure things? I said, did you know that that person over here? Hey, Bob, come on over here. Tell him what you had over here. He said, what do you mean? Oh, I used to have prostate cancer. He said, yep, used to have prostate cancer. He goes, you don't have cancer anymore? No, I live in Dallas. He flies out once a month, comes to get checked. I scan him. He was clear today. So I scan him. He's clear. He got on a plane and went back to Dallas. His visit was minutes long. I didn't have to touch him. He's neurologically sound because the objective gauge that I use told me you don't have to adjust. Chiropractors believe more adjustments is good for you. I don't. To me, I believe I don't want to go to the dentist looking forward to having a cavity. I want to go in, clean a bill of health. Your teeth are good, Eddie. Go leave. Oh, you're not subluxated. Go leave. And so I only water my plants when they need to be watered. What gauge do you use? I've got a gauge that tests the moisture. Why wouldn't we do that? I've got a gauge that tests the spine. That's how I do it. Doesn't make anybody else wrong, but at least have some objective analysis. And this is where I'm going so strong with thermography because we have a gauge. Chiropractors can use this. It's running up the spine. I palpate it, great. I palpate, we all do. But again, what proof do we have that we've done something constructive before and after? Because that, I saw.
Yeah, well, you better make sure you know what you're palpating and you have what what you're looking for.
Right,
Because
right.
it has to be that change. Because I
Yeah.
would say even the term adjustment is misused by chiropractors. It's a black and white term.
Yes.
Either an adjustment has been made or it hasn't.
Well, I also feel the same way about subluxation. Either you're subluxated or you're not.
100%. It's
Yeah.
totally, and it works in the same way.
Yeah.
Either people subluxation is present or it's not.
Yeah, yeah,
Either an adjustment has happened or it hasn't.
yeah.
And
Either they're adapting or they're not adapting, right? Either the body's in a state of flux after the adjustment. I mean, it's, my goal is I teach everybody, you don't want to be adjusted. You want to be holding your adjustment, which means your body is neurologically sound. What I teach, you know what I mean?
I would say, and I know the holding thing has always come up. I've been, 40 years. I totally disassociate myself from any outcome. Like I would never talk about any condition that went away because I don't want to
Totally agree.
Totally distanced. As far as somebody holding or not holding, I totally distance myself from that. I want to come in and be as objective as possible, palpating that spine, A&P.
You want to be objective as possible with a subjective analysis.
All analysis is subjective. Even with you, just like you said, we don't know what we're measuring. We don't know what we're looking at.
But you're measuring something that's objective. It's outside of my own thinking.
Well, we could argue
like a thermometer. The thermometer, what is it measuring? Heat. Well, it's an object. What is it? It's just heat, right? The thermometer, if I'm using it in my mouth, that's objective. It's not what I make it think. I can't make it be something.
No, but what we can palpate, and there can be a very high correlation of people finding the same ropey muscles and those muscles being gone. Is there an art form to this? Yes.
Sure, there is. I mean, BJ did a huge study with that, 200 patients, right? And chiropractors swapping back and forth, and who correlated. Only 2 chiropractors out of 200 had the same findings. And so it's again, because
and I know he put the BB on the Atlas too, and things like that, and took X-rays where people were placing the BB where they thought the Atlas, and
right.
people were on that.
Well, this is fine. These are full spines, just analyzing the vertebrae, right? Saying which one it is. It doesn't even matter which vertebrae it is. Again, you want to identify, is it tensile? Is it constricted? Is it restricted? But is it neurologically compromised? And so again, when somebody says, I know you work here, doc, but what about down here? I'm like, well, let's check it out. I do a full spine analysis. I make the adjustment and all of my graphs go clear, full spine. And they're like, wow, you moved this and that totally changed. I said, because that's usually compensating for what's going on above. Per the technique, right?
Yeah,
Per the technique.
I would say, well, what is a compensation? Because they felt pain there?
Because they what?
You're saying there's a compensation because they felt pain there?
No, there's compensation because I moved this vertebrae and the heat, if you will, changed down below. But nothing to do with symptom relief.
But they said, like, doc, what about here? Weren't they saying that because they were hurting them?
Oh, yeah.
So it's like
But that wasn't my
That
goal
was
to
a
fix
comp-
that. My goal is to find out what's going on with
I'm
the
not
nervous
saying
system.
that. I'm
You know
saying
what I
to
mean?
call it a compensation, we don't know what that is. We don't know what that is.
No, we
The
don't.
reality is, and we,
But
you know,
is it compensatory if I move a vertebrae nowhere near that area and neurologically our heat reading completely changes feet away from where I'm adjusting?
as far as neurologically, I don't know what you mean by that, and I don't know how the instrument you can say this is correlating
Sure,
neurologically. I
sure.
understand this theories, so I don't use
Well,
that.
it has to be neurologically because if the vertebrae, per the subluxation definition, if I'm moving a vertebrae and something changes on a physiologic, then it means I did something neurologic. Because in order for physiology to change, neurology has to change.
The terminology I would use is if a vertebral subluxation is present, that's a bad thing.
Yeah,
If I introduce the force and the body made an adjustment,
yeah,
that's a really good thing. And I have the analysis that I utilize. And there's, and I've taught a lot of students, and I had a lot of chiropractors work with me, and there is quite a bit of level of correlation when you're seeing that same person over and over again. Is there going to be correlation if I saw a person just once? Absolutely not. I'm going to say this with any technique. Seeing a person one time, you
right,
do not conclusively know that an adjustment has been made.
sure,
Chiropractic, one, is never priced a service, and two, must be consistent if people are going to get the full benefit.
yeah,
Because in any technique, as you see that person more and more, you get a lot more objective with every technique
sure,
by consistency.
yeah,
And what you thought was a vertebral subluxation initially may not be what your findings produce 6 months down the road when you're seeing that person on a consistent basis.
yeah,
So
yeah,
what I would say is I wouldn't use the term neurologic for me. For me,
yeah,
I would use the black and white term of what the chiropractic entity is: a vertebral subluxation. This vertebral subluxation has been adjusted through the criteria that I utilize. I don't use instrumentation.
sure,
I use and if you say that through my analysis, the vertebral subluxation has been adjusted, I'm like, okay, now we can agree on that. It's when we use terms like neurological that, okay, I
sure.
know a lot of other
Well,
professionals
but
use that
I
term.
mean, I'm 100% with you.
Sure.
However, I mean, not even negating what you said, proving some sort of objectivity, then with that theory, is there really a science, philosophy, and art?
There is definitely, yes, definitely is. When we look at
Okay.
chiropractic,
So the science is the argument then, you know
well,
what I
I
mean?
would say the science is the repeatability that we can use this technique over and over again. And there are folks who've been coming in to see me for every
Sure.
week for 25 years. I can palpate
Yeah.
their spine, and whenever deeper subluxation is
Oh,
present,
I totally agree. Hence, when I see
un-
somebody 18 years apart and I scan them and I'm getting data, that's a reproducibility in that patient, right? And that would be the if you had a scanner and I had a scanner and I sent you my patient, I can send you the file, you can scan them and start the work exactly how it's been, how the continuity between one chiro to the next.
it
Not
would
a
be
technique, not
it's,
technique.
it
Yeah.
would be close. It wouldn't be exactly the same, because
Oh,
your hands.
it should be really close
I don't
because
know. I think that's highly arguable because, it's going to depend on the hands of the chiropractor. It's going to, I mean, whether those hands are working the instrument or facilitating the adjustment. That
yeah.
they're
Well, the adjustment's different. That's the art. We're talking the science, right? That's the art.
okay.
The
And
analysis should be similar.
yes,
Yeah,
yeah, and I'm with you. And I would look even at the 33 principles as the basic science as well. So, and there's so much overlap. So we took the 33 principles that were a philosophical concept or taught as such that
yeah,
now are a basic science. You
yeah,
see,
yeah,
you see.
yeah.
So, and please understand this. I'm coming with this with the utmost respect because I love this back and forth.
I love it. I mean,
Me too.
this is healthy. You know,
It is, and it's fun, and I want to disagree, and I want to hear this because what you're saying,
well, yeah, I'm
you
not
make
even
a powerful,
disagreeing. We're just seeing
we're
another
not, but you
side.
make a
You know what I
powerful
mean?
argument. My
Yeah,
point is, I like what you're saying, and I see the correlation throughout. I've seen correlation with instrumentation. My preference is the AMP because of the philosophical component behind the
sure.
thinking and the research that backs it through, anatomical findings. But what you're saying, I love where we're going. So
Yeah,
we're
yeah,
going to
yeah.
continue this. Now look, we're going to be in touch and we're going to talk some
Because
more.
I would be curious on AMP if you used any digital, like an objective digital range of motion device. So
I
I've
know,
got one
I
of
know what you're
those.
saying. Yes,
So
I
that would
know.
be kind of cool, because if you're finding restriction of that vertebrae, it would be kind of cool to see the before and after of a range of motion that's moving there.
And I don't do anything in regards to restriction or range of motion. It's specifically and exclusively analyzing the paraspinal muscles from,
Right,
around
right.
the
And I
ankle.
get that. I'm
Yeah,
just thinking of the juxtaposition of the vertebrae. Wouldn't you want to know if that vertebrae is juxtaposed, it's fixated, it's stuck. And then the muscle tissue is holding that joint capsule as such. So as you introduce a force, that should be moving much better.
and this is another good,
Theoretically, theoretically,
but
theoretically.
I'm with you. But here's another thing
We could
too.
be here till midnight, yeah.
We could, because I was talking to another great chiropractic historian, brilliant mind, who's also not only a chiropractor, but a spinologist as well. And he was very close with Reggie and Joe and Strauss and Joe D.
Yeah.
Tom Gregory. And one of the things we've been talking about is not only the hypomobile component, but the hypermobile component
Yes.
that can be part two. So we're gonna continue here, Eddie.
Compensatory,
Yes.
yes.
Listen, we're gonna talk some more. This is great stuff.
Yeah.
I'm gonna stop the recording, and folks, thank you for watching. This is Eddie Weller, and I'm Mark Romano. Folks, we'll be seeing you all soon. Eddie,
Yeah.
thank you, and thank you everybody
Appreciate
who
it.
joined us. This is great stuff, man.
Love you, brother.
Love you too, bro. I'll be talking to you soon. Okay.
Yeah.
Thanks, bro. Have a good night.
You too. Bye-bye.
Thanks. Bye bye.